If you have ever had to deal with a kidney stone, it is not something you want to experience again in all likelihood. Now doctors at CHI Memorial can use metabolic screening to find out if you're likely to develop kidney stones in the future. It is so nice to have Dr. Jeffrey Mullins here from the Chattanooga Urology Associates based at CHI Memorial. Good to have you.
Thanks for having me.
I will go ahead and confess to you, I've been very lucky. I've never had a kidney stone, but I know several people who have, and it's agonizing.
Yes, absolutely.
So is the metabolic screening designed to set you up for future diagnoses, whether you've had one in the past or have a family history of it?
Well, the problem is people who've had a kidney stone have about a 50% chance of having another kidney stone within 5 years.
Mm.
So we try to limit their trips to the ER, limit their trips to the operating room by identifying their individualized risk factors and try to intervene to prevent them from forming further stones.
The metabolic screening, what does it involve?
Really, it's some blood work and a 24-hour urine study where you collect your urine for 24 hours, you send it off to this company, they analyze it, they send it to me. Then based on those results, we can really understand what's going on as far as the cells in your kidney and why you form kidney stones.
So is it really like it sounds, that your individual metabolism may predispose you to developing a kidney stone?
Absolutely. Some stones are due to an abnormality of how the kidneys handle minerals such as calcium and sodium. Sometimes it's an abnormality of pH or how acidic or basic the urine is. And sometimes people have problems with uric acid or cysteine. The list goes on and on. But if we can identify people who have a known risk factor and put them on a pill or two a day, that can keep them out of the operating room, which will help their overall health, help their kidney function, help save them and the healthcare system money.
So does this mean that if you're someone who has suffered with kidney stones for a while, I've heard before is that sweet tea can be something to cause a kidney stone, which is not something that you want to hear around here.
Right.
But is that kind of a false myth?
Sort of. So sweet tea, things with caffeine, can actually dehydrate you over time, and dehydration is a major risk factor for forming stones. Basically, the more dehydrated you are, the higher the concentration of minerals in your urine are, and then that can lead to crystallization of stones and forming stones. So general recommendations for preventing stones is good hydration, actually eating a normal calcium diet, relatively low protein, and limiting the salt and salt-related foods in your diet as well. Relatively low protein? Yeah.
Okay.
Yeah, so how calcium and sodium are metabolized in the kidney, they go hand in hand. So you're eating higher salt foods, and you may get more calcium in your urine as well and predispose you to forming calcium stones.
So to get the screening, can you self-refer, or do you have to rely on a doctor's referral?
You can self-refer. We're happy to see folks who just want to come in for screening. The people who really need screening are people who form stones at early ages, young folks in their 20s or 30s, people who have had 2 or 3 stones in the past, people who have had large volume stones requiring more invasive procedures. Try to limit that to just one invasive procedure per patient if we can. So people who sort of have a long-standing history or family history of kidney stones should really be screened early. And
so the idea is you come in, you go through this test, you get the results back, what, within a week?
About that. So you come in, we kind of assess your stone burden. If you have an acute stone episode, we don't do screening in that setting. We try to get you stone free, and then at that point initiate screening. The whole process takes a couple of weeks, and then we meet back in the clinic. We go over your blood results, your urine results, the composition of your stones, and then base a plan, which could be pills, it could be dietary modifications, and that's really about it. And so with that proper guideline in place, the hope is that person will become stone free, or at least if they do surface, they'll be much more reduced. Yeah, I mean, we just try to limit the number of acute stone episodes a person has, because in reality, when you are suffering from a kidney stone, it always happens at 2 in the morning. You have to go to the ER, then you get referred to the urologist, and then you get to have surgery. It's this ongoing process, and if we can just try to limit that to just a couple of times per a person's life, that would be ideal. Well, suffering is the right word. Anyone who's ever had it before will tell you it is insufferable. Yes. You don't have to live with that anymore. It's the Chattanooga Urology Associates at CHI Memorial right there on Glenwood Drive. Their phone number is 697-0072. Thank you so much. Thank you. We're back after this.